Hey, Delaney.
Hi.
All right, so I don't think this one will be as bad as the other one. Um, to me,
All right, yeah, the practice one for this one was easier.
I just felt like it was a little easier too. So, hopefully this will be fine. Get to the right spot here so I can get you a code. Oh, here, I'm going to fix this too so you get more time. Not that I think you'll need it. You'll probably be fine, but oh,
It's nice to have it.
all right, there's your code. I'm going to
Thank
mute.
you.
I'm going to mute myself so you don't listen to me.
I'll mute myself too. Can you hear me? I can't hear you. But did I pass that time?
Yep, 100%.
Okay, cool. Thank you.
All right, you're good. Um, who's on here now? So we got Erica. Erica, do you want to start your test?
Yes, please.
Okay. Let me get you your code. Okay, there it is. You see it okay? Yes. Hey, Maya. Do you want to go ahead and take your test?
Yeah.
Okay. Here, I'll repost the code.
individual one-on-ones and everything. Whereas
Mrs. Silk.
Yeah.
Could you look at the chat for me?
Sean, what are you doing? What are you doing? Why did he say get away from me? What are you doing? Okay, everyone. It seems like everyone's done with the test now, so I'm going to go ahead and show you guys the test real quick so you can see if you've got anything wrong or not. I believe most of you did really well on this, so I don't think there's too much of an issue, but this was probably the easier of the two math tests we did today, I think. If you had any specific questions about anything, you can ask me real quick. Is there any specific problem anyone wanted to see or anything?
I'm good.
Okay. All right. Well, if you wanted to ask me separately too, you can. That's not a big deal. All right. I'm going to go ahead and stop sharing this, and we'll go ahead and get started into our stuff. Real quick before I get started, I just want to make sure you guys are aware that you have to use your Herzing email to get into all of the stuff for clinical, like VSIM and anything else that we may be doing for clinical. Everything has to be through the Herzing email. So I know the other day when I got in to look and see stuff, there was only like 3 or 4 of you that were registered for VSIM. And I thought, well, what the heck? So I asked, and I heard that people were still doing it, but they weren't showing up in there. So make sure that you're using your Herzing email, and make sure that your instructor can see everything that you're doing, because if we can't see what you're doing, you're not getting credit for it. So make sure you check with both instructors to see if they can see everything that you're doing.
So for when you say Herzing email, well, like when they had us register for the point or whatever, they told us that if we had a returning like username that we've had an account before, there was a certain way to set it up, but they didn't say anything about incorporating our Herzing. You know what I'm saying?
Yeah, I get it, but that's how it has to be so we can see your progress, because it won't show us otherwise.
Okay, so how do you go about changing that then? Like, how do you register with another email and then register for the class again?
I think you could probably go to that, the VSIM stuff on the website, to talk to them about it and see if you can do it differently. Do you know what I'm saying?
Yeah, so just contact technical support then.
Yeah, I would, because that's a problem. We need to be able to see your progress. It's just going to look like you're not doing anything when you really are,
Right.
So we just want to make sure we get that fixed. Okay, a couple other things I wanted to say too. I got a practice, or it's not a practice, it's like an example paper for this community stuff that you guys are doing. You know how last week we broke into 2 groups and stuff? So this lady I'm talking to at one of the other campuses, she sent me a paper that she's had from other groups that have done this. And so I will post it on Canvas so you guys can all look at it for reference. So every week we need to be like working on something for this paper every week as a group. So I don't know if you guys want to like pick one of you to be kind of like the leader of the group or something to make sure everyone's getting things accomplished. Because if you fall behind and you don't get things done, then you're going to have all kinds of things to do in a short period of time. So it's better to take this paper and project in little chunks, because then you can do it a little easier and it's not so bad. So as long as you stay on a good schedule with getting things done, I think it'll be way better. So I'm going to post some things later today after we get off here for class that hopefully will help you stay on track with when things are due. And then hopefully after you look at that example paper too, it'll make a little bit more sense on what we're expecting. Okay, so today we had two chapters we're supposed to go over, chapter 3 and chapter 5. So I'm going to see if we can go ahead and start with chapter 3. All right, so chapter 3 is the changing U.S. health and public health systems. So in here, we're supposed to describe events and trends that influence the status of the healthcare system. We're supposed to discuss key aspects of the private healthcare system, compare the public health system to the primary care, and then explain the model of primary healthcare. Also assess the effects of healthcare and insurance reform on healthcare delivery, and evaluate the changes needed in public health and primary care to have an integrated healthcare delivery system. Okay, so there are certain forces that stimulate changes in demand for healthcare. So demographic trends, that totally makes a difference. If you think about our population now, we have a bigger population of older adults than we ever have, and that's going to continue to grow. So older adults and their needs for healthcare are going to increase, right? So that is going to affect the demand for healthcare. Social and economic trends. So we tend to see that when times are bad and, people can't afford to do a whole lot of stuff, they don't seek out healthcare because they can't afford it. They would prefer to eat than to go to the doctor, So you'll see stuff like that. Health workforce trends. So, if we have a shortage of nurses or whatever at the time, then maybe access to healthcare isn't as good, or maybe your quality of care isn't as good because of that. And then technological trends. Technology is just increasing and increasing over time. And so, some of these trends will definitely affect our healthcare as well. So we have an aging baby boomer generation. So this is people that were born between 1946 and 1963. So they're expected to live an average of 83 years of age. A lot of them will survive into their 90s. But the cost of Medicare is expected to rise and keep going up astronomically. Fewer workers pay taxes into the Medicare system right now, too. There's also a rise in people coming here from other countries, so foreign-born population. So Mexico is the largest source. This is followed by Asia, and now we're just more diverse than we ever have been because we have all of these different groups of people living in the United States now. And changing lifestyles affect, healthcare as well. So if you think about, if you knew anyone who lived back during the Depression, they just valued things a little bit differently compared to the people of today. So if they were going to waste something, like they never would waste anything. Like my grandparents, I remember watching them with eating, they would always save stuff. And then they would come up with another use for it. So they would never get rid of a whole lot of stuff. They would save everything, because that's how they grew up in that time, that Depression, and they valued everything that they had. So now we're more kind of a selfish generation, and we don't look at things the same way. We just want excess everything, So during this time now, there's a growing appreciation of quality of life. So health is seen as an irreplaceable commodity. Families are kind of different now. We have a lot of blended families out there, a lot of single parent families. There's a lot of different types of families out there. And then there's changing household incomes as well. There's a growing gap between the richest and the poorest out there. And then there's also a revised definition of quality healthcare. There's a rise in complementary and alternative therapies too. So there is a nursing shortage, particularly with minorities. And periodic shortages in primary care providers and a growing number of nurse practitioners now, which is good. We need more nurse practitioners. But it's kind of sad that we have such a nursing shortage. You know, we need a lot more nurses out there to really, you know, accommodate for all of the people who have more and more needs. So with these technological trends, there is something called telehealth now, and maybe some of you have used it before. When, especially during this time when we have this pandemic going on, if you are sick and you need to see a physician, a lot of places wouldn't let you come in to go get seen. So a lot of places would just prefer to talk to you online like this and try and do a diagnosis that way instead of, you know, risking, you know, stuff spreading. So telehealth is the use of electronic communication networks to transmit patient-related information. So a lot of companies now offer that as something that you could do. So like, say I have just, I don't know, maybe I have an ear infection or something, or I have, you know, like minor symptoms of something. You could go on telehealth and talk to a physician and they would ask you some certain questions, and then they could order you whatever you needed instead of you having to go all the way into the doctor. So it's kind of nice. The electronic health record, that's another example of a technological trend, which is great, because can you imagine if we didn't have all of that information at our fingertips on the computer? It would be crazy trying to flip through the paper chart finding things. There's lots of good benefits from some of these trends, and there's some drawbacks. So some of the benefits are, you know, we have this availability of this information at our fingertips all the time, 24 hours a day. It helps us coordinate care between different places. So if I had an appointment with my, I don't know, my dermatologist at some place, and then I also had an appointment with my primary care physician at another place, both places communicate with each other through the electronic health records, so they can see, you know, if I got a new medication ordered or if I had new testing done or something, so they didn't duplicate anything or anything like that. It improves our quality measurement and monitoring. It helps reduce medical errors, which is great because that's a horrible thing to happen when you have a medical error. Drawbacks would be privacy and security concerns, because sometimes that's you know, something that you have to really worry about with some of these technological things that we do. Inconsistent quality of online resources, and then expensive equipment that requires higher training would be some drawbacks. And then this gets into causes of disparities in the US healthcare system. So the big three would be cost, access, and quality. So with cost, back in 2008, we had the Great Recession. We had a weakening national global economy, and a bunch of people lost their jobs. We had a really big increase in national health spending, and insurance premiums went up a lot. So we had the inability of workers to pay an increased cost, and this equaled a rise in the percentage of uninsured working families. So it was a bad time. With access. So with access to care, there's a rise in uninsured people. Well, this is saying rise in uninsured people to 48 million in 2012. So back then, we had a lot of people still who were not insured. Government programs, you know, weren't good enough to help with those uninsured people. We needed more done. So groups who are really at risk for access issues would be poor working or non-working people, minority groups, and non-English speakers, including illegal immigrants. And then with quality. So back in 2000, there was a report that came out by the Institute of Medicine called To Err is Human, Building a Safer Health System. In this report, they came up with, you know, some things that were kind of worrisome in our healthcare system that we needed to fix. So in 2003, they came out with another thing that was called Keeping Patients Safe, Transforming the Work Environment of Nurses. So, like, one of the things that they talked about in that report was long working hours. So people who would, maybe you're on for a 12-hour shift and your supervisor says, hey, can you work another 6 hours or something? And someone lets you do that. Longer work hours pose a serious threat because you're tired, and when you're tired, you make mistakes. So it not only can affect you, but also your patients. And then there's more of a trend now for like trying to really focus on safety. So like there's different things about, reporting sentinel events in hospital systems. So a sentinel event is when there is a death in the hospital that maybe is kind of sketchy, like you're wondering what really happened that they need to do an investigation about. That's a sentinel event. Also, you can get online now and compare hospital to hospital to see who does better in what. So like I might be able to compare SUMA Akron City to Akron General and see who is better in pressure ulcers and who is better in, I don't know, cardiac care and whatever. Like you can look at that, and that's actually something that's reported now, where it used to be you couldn't do that. And then a lot of places are really putting more stock into being accredited. So public health accreditation shows that you have high quality at your facility. Excuse me. All right, so then this gets into the organization of the healthcare system. So we have the primary care system, the public health system, the federal system, the state system, and then the local system. So when we talk about primary care, this is accessed in our country through insurance. There's a network of providers who agree to comply with case management approach. There's a gatekeeper who controls access. And you have things like HMOs and PPOs, so health maintenance organizations and preferred provider organizations. Then also there's Medicare and Medicaid that also, gives you access to primary care. When we talk about public health systems, so this is national, state, or local laws that mandate what the public health system is like. We also have multi-level federal, state, and local systems that affect this as well. Local health departments provide care that is mandated by the state and federal regulations. So examples of public health laws instituted to protect the health of the community include a law mandating immunizations for all children entering kindergarten and a law requiring constant monitoring of the local water supply. And I'm pretty sure on your test there's a question having to do with public health and primary care, like what's the difference between the two. Okay, the federal system. So the U.S. Department of Health and Human Services regulates healthcare and oversees the health status of Americans. So there's all these different departments that fall under the federal government that help with our health. So we've got like Office of Global Health Affairs, the National Institute of Health, Centers for Disease Control and Prevention. There's all these different ones. And then with the state, we have disaster prevention and readiness that the state is responsible for, healthcare financing and administration, mental health and professional education, health codes and licensing, insurance regulations, direct assistance to local health departments, and the Board of Examiners of Nurses. Healthcare financing and administration for programs like Medicaid provide mental health and professional education. They establish these health codes, licensing facilities and personnel, and regulating the insurance industry. With the local system, So this is directly responsible to the citizens of the community or jurisdictions. So services vary depending on health codes, community needs, funding, and resources. Okay, so things that influence change in the healthcare system. So remember we talked about cost a little bit earlier. So high costs, that's totally a problem of today. We can't seem to get it under control, our healthcare system and all the costs that everything is. There's uneven quality and access. So we see it all the time that, you know, if there's someone who lives, you know, really far out in the boondocks somewhere, they don't have good access to care compared to someone who has 3 or 4 hospitals around them, right? Or even like different minority groups, they don't have good access to care compared to other people. Access depends on your ability to pay, so that's part of the problem. You know, if you are of low socioeconomic status, that's an issue. And you know, unfortunately, healthcare is a big business, and you know, it's all about money. So people who run these healthcare systems, they have to think about that. So what the nation right now is trying to figure out is who is going to be provided for healthcare, who will be in charge of what, and who will pay for what. Okay, so the integration of public health and primary care systems. So historically, they're separate systems. The Institute of Medicine Committee is formed to examine the integration of the two. So there's clear definitions to guide integration, and the purpose of the integration is to give better care to everyone. So let me read to you this. The primary care is providing integrated, accessible healthcare services by clinicians who are accountable for addressing a large majority of personal health needs while developing partnerships with patients and practicing in the context of a family and community. Public health is fulfilling society's interest in assuring conditions in which people can be healthy. Okay, so there are some potential barriers to integrating both. There's different roles, functions, and you know, focus. So the primary care person is more person focused. They're, you know, looking at that specific person and what they have going on. Public health is more community focused, so they're looking at the greater good for everyone. Also, there's different funding models. So primary care, usually there are payments that the client will you know, do to get their health care, and health insurance helps cover a lot of that. And then with public health, you've got tax dollars and federal grants and things that help pay for that. So which represents funding of primary care? So this is going to be health insurance. Okay. All right, so health insurance or individual client payments represent funding of primary care. Public health is paid through tax dollars and the federal state grants, like we just said. So when we talk about primary health care, the goal of this is to integrate that and public health so that people get better care, right? So in 1977, the primary health care movement began. 1978, we had the Declaration of Alma Ata, which is the Health for All by the year 2000. 1998, we had the Health for All in the 21st century. So primary health care is highly political, and each UN nation interprets goals based on its own culture, resources, needs, and type of government. Most nations have not achieved these goals. So there is the Healthy People 2020 objectives. So one of the 4 main goals that they have with Healthy People 2020 is we want to get people to live high quality, longer lives. free of preventable disease, disability, injury, and premature death. We want to achieve health equity, eliminate disparities, and improve the health of all groups. Create healthy environments that promote good health for all. Promote quality of life, healthy development, and healthy behaviors across all life stages. And then this is saying healthcare delivery reform efforts in the United States. So this is kind of what's happening. So 2005, we had Healthcare American Nurses Association agenda. They said basically healthcare is a basic human right for everyone. Everyone should be able to have access to it and get it. Policies are based on outcomes of research, so the policies that they have, they're trying to save money. We need to find a balance between high-tech and community-based prevention, and the single-payer mechanisms are most desirable, is what they said. So back in 2010, we had the Affordable Care Act that came about. And there's kind of a lot of good features of that. Let's see down here at the bottom. The Affordable Care Act kind of gives people better access and kind of higher quality of care as well. If you think about it, before 2010, like the way things were before, it totally did help a little bit. Whether you're for the Affordable Care Act or not, I think it was a step in the right direction, but I think maybe it probably needs a little bit of tweaking as well. But basically, out of this chapter, you need to kind of just get the idea between what primary health care is and what public health care is, and how to integrate both of them together. You need to know the difference between those. All right, guys, we're going to take a little break here, and then when we come back, we have one more chapter to go over, and then we'll be all set for the day. So don't forget, we do have discussion posts in here as well. So I did not make these. These were already made before I even got this class. So I think they're kind of focused more on what you did for VSIM for the week or something. So they're maybe a little bit more in depth than the other class. So you may have to spend a teeny bit more time on them. But if you wanted to, in the break here, you could work on that for a little bit if you want. So what time do you guys want to come back?
I don't care.
Yeah, it really doesn't matter. This class is over at 3:20.
I think so. Do you want to do like 2:30 or something?
That works.
All right, let's do 2:30. We'll come back then. And you can come back to this same Zoom meeting. Okay?
Is the paper you're talking about in our announcements that we can oversee?
No, I didn't post it yet. So
okay.
I can hear in the break though.
Okay, I appreciate it. Thank you.
Uh-huh.